Good afternoon, everybody. Welcome to the Higher Education Center for Alcohol and Drug Misuse Prevention and Recovery ScreenU Webinar. We're excited that so many of you were able to join us today for an informative and engaging presentation. My name is Kristen Dahlquist, and I'm the Program Manager here at the Higher Education Center. With me today is Cindy Clowner. She's our prevention specialist for the Higher Education Center. Cindy and I have worked together on ScreenU since its inception, and we're excited to show you the program and its features today. Before we dive into the webinar, I'd like to go over a few points on the technology we're using today. Below, you can see there is a chat function. It should be on your right-hand panel of your screen. This is where you can send us any questions throughout the webinar, and if we have time at the end, we'd be happy to address those questions and go over any additional features that we don't get to today during our webinar. And everyone's phone is muted to eliminate background noise. And if you have any questions, again, just message us. I think that's the best way to go about it. Now that we have that covered, let's get started. The Higher Education Center is a partnership between the Conrad and the Hilton Foundation, the College of Social Work, the College of Pharmacy, the Office of Student Life, the Collegiate Recovery Community, and the Generation RX Initiative. It is the mission of the Higher Education Center for Alcohol and Drug Misuse Prevention and Recovery, in partnership with the nation's colleges and universities, to promote student success nationally by providing data-driven solutions to alcohol and drug misuse, lead the dialogue on collegiate alcohol and drug misuse and recovery in the national agenda, and to ensure the long-term sustainability and effectiveness of the center's efforts. The center was reestablished at Ohio State in 2014 thanks to the Hilton Foundation. The Higher Ed Center is an interdisciplinary center, and we have a big mission and passion for creating technology to help you do your roles at the colleges and universities all over the country. So we'll start by reviewing what the prevention paradox is. Prevention paradox states that most alcohol problems are not caused by dependent drinkers, but a greater societal gain will occur by achieving a small reduction in alcohol misuse within a larger group. One of the things the Higher Ed Center is passionate about is creating technology that addresses alcohol and drug misuse on a population level. ScreenU does just that. It can reach all of your students in a short amount of time, reaching not only the people with an alcohol dependency, but those who just drink in a risky manner. So ScreenU is a program that basically digitizes SBIRT. So we'll review for a minute what SBIRT is for those of you that aren't familiar. SBIRT stands for Screening, Brief Intervention, and Referral to Treatment. The first step to SBIRT, again, is the screening. We have 3 different versions, 1 alcohol, 1 prescription drug, and soon to be marijuana. The alcohol screening uses the World Health Organization's audit, which is a 10-question screening. The student will then be placed into a bucket, either yes, they are drinking at a risky level, or no. If a student scores at low risk or no risk, a healthcare provider would then reinforce that positive behavior. If the student is at high risk or moderate risk, the healthcare professional would then ask further questions to assess this level of use. From there, those with a high risk use receive a brief intervention, and those with severe use would be referred to treatment. There are a lot of different modes of delivery for SBIRT, the most common being face-to-face. This was created back in 1987, and since then, the typical place for SBIRT to occur would be a health center, an ER, a dentist's office. But since then, technology has woven its way into every aspect of our lives. There have been, new ways to deliver SBIRT. Computer-based is another common way that SBIRT's delivered. Social worker assisted basically refers to when a student or a person takes the screening portion, either by a computer or on their own with paper and pen, and then a social worker would do the brief intervention and the referral to treatment in person. Fourth, this is actually pretty common in higher ed back in the day, but the brief intervention and the referral to treatment would happen with a letter with follow-up. So a student would receive a letter in the mail, and there's actually evidence behind that working. And lastly, a text message booster. So the brief intervention can continue to occur in boosters over text messages. So there is a lot of evidence behind SBIRT. Most commonly, the last 5 years, there have been close to 1,000 research articles on SBIRT to prove its effectiveness. But it's been shown to reduce the typical BAC of a student, the peak BAC, the peak number of drinks per setting of a student. So they're drinking fewer drinks when they do go out. The average number of drinks per week is reduced, and the number of drug episodes per week has been reduced by utilizing SBIRT. This is a neat graph that Everfi had put together. They did all the research behind it, and we found it really impressive when they shared it with us. They're actually coming to the national meeting in August, some of this data. But one thing that I wanted to point out to you with this graph, they've looked at the impact of each of these prevention or intervention methods for alcohol use, and then they cross-checked it against the cost. Number 29 here is SBI in a healthcare setting. So screening brief intervention in a healthcare setting. And this is most typically done in person, face-to-face, which is why the cost is so high. But you can see the impact that it makes is really, really great. Just behind number 17, which is group motivational enhancement. So both use some of the same science behind it, but it is important to note that the impact behind these two modes of intervention is positive, and it's worth noting. Again, if you're interested in studying this more, I'm sure Everfi would be willing to share that neat data with you. There are some issues with implementing SBIRT on college campuses, which I'm sure most of you are aware of. But one thing is training. So you would need to train individuals on campus to be able to provide this motivational interviewing and SBIRT on a student health center or in the student pharmacy. So training is an issue. Integration is also an issue. The resources, it can be costly to implement SBIRT on a college campus. It's costly everywhere. Reimbursement is also an issue. So Medicare and Medicaid just created with the Affordable Care Act reimbursement codes. There are issues with utilizing those on college campuses because oftentimes students are not on Medicaid. Saturation. So there's a lot of different good work, pieces of good work that you guys are doing on college campuses. And so it's difficult to figure out what works best and what would serve your students best, and administrator buy-in. So those are all things that are worth addressing while you're deciding if SBIRT's right for you and your campus. And now I'll turn it over to Cindy.
Thank you, Kristen. I am Cindy Clowner, and I am a prevention specialist with the Higher Education Center for Alcohol and Drug Misuse Prevention and Recovery. And I'm really excited because I have the opportunity to share the program with you, ScreenU. And as Kristen just mentioned, there are a number of barriers that a college campus may come into while they're looking at implementing in-person SBIRT. And so our hope with ScreenU was to develop a program that would allow for campuses to implement SBIRT in a more widespread way, moving it beyond the clinical setting. And to do that, we wanted to digitize SBIRT. So we created our program ScreenU, and it takes the components of SBIRT, and it's based in the research of SBIRT. It digitizes the process to allow us to move it beyond those clinical settings and use it in really an unlimited number of ways on your campus. All right, so let's take just a quick look at some of the benefits of ScreenU. So ScreenU is a web-based program. That means that it's accessible on any web-enabled device. So a student can take it on a laptop, but also on their phone or their tablet, and it doesn't require any kind of downloads to be able to access the program. It's brief. Students take about 5 to 10 minutes to complete ScreenU. So it doesn't take long at all. It also doesn't require any training to implement. So SBIRT uses motivational interviewing as part of its key components for the program, and we've adapted motivational interviewing into ScreenU, but that motivational interviewing requires training for someone to be able to do that. And because we've digitized that process, it no longer requires that training to be able to be implemented. Students also are connected with vital resources on your campus and community, and we'll talk a little bit about the resources that are available and how that works once we dive in. ScreenU offers real-time reporting to campuses, and we also have customizable elements that allow you to customize the program to your campus, including your campus logo, the resources, as well as a welcome and thank you message that are attached to each campaign. So we are piloting ScreenU currently in 26 campuses across the country, and the states are highlighted in that light green color on our map, so you can see where we're piloting. We have a combination of public and private schools, both 2-year and 4-year institutions, large and small, and they're currently implementing ScreenU in a variety of ways so that we can identify any successes and barriers and challenges to implementing ScreenU, so we can help develop some best practices with it to provide you some more guidance as you look at implementing ScreenU on your campus. And they've really become creative with some of the ways that they've implemented the program. And so because ScreenU doesn't require an individual to deliver the program, it can be delivered in lots of different avenues. So student health services and other clinical settings like counseling centers make a lot of sense because SBIRT has historically been done in a healthcare setting. But again, it's not necessary. So student wellness, academic advisors can use the program. It can be used with Greek life and athletics, student conduct and residence life, as well as during outreach events. And so we've been really excited to hear about some of the ways that campuses have been using ScreenU, and don't think that this is an all-inclusive list. Because each day we hear more about campuses that are looking at utilizing it in a unique way. So let's talk a little bit about how ScreenU works. So we're going to walk through the screening in just a second, but this is just kind of a brief overview of what you're about to see. So students will take the screening. They receive a gateway question that'll help them indicate whether or not they need to move forward in the screening. We use, for our ScreenU alcohol program, the audit, which is a World Health Organization screening tool. It has a lot of research behind it. For our ScreenU RX program, though, we did a lot of research on screening tools and found that, one, there's very few that look at prescription drugs specifically. A lot of them group drugs together, and we wanted to really focus on prescription drugs for ScreenU RX, but we also wanted to look at the behavior around a student's prescription drug misuse, and we couldn't find any screenings that did that. So we developed a screening in-house at the Higher Education Center to help identify not only a student's risk level, but also their behavior around the misuse so that we could combat any misperceptions that there may be with that. Once students take the screening, they receive some feedback based on their risk level as well as behavior-specific feedback. They engage in some open-ended questions that simulate that motivational change, as well as are prompted to consider how ready they are for a change and how confident they are in a change. And then they're connected with those resources that are specific to your campus and community. So a couple other highlights before we dive in. We've talked about those resources. They're customizable to your campus and your community, so you have complete control over what resources your students would see. And we think this is really great because we know so many students are on your campus for 4 years and don't realize how well supported they are. So this connects them with those resources. We also have the ability for students to indicate whether or not they're in recovery. And if they do, then they're connected with a specific set of resources that are oriented to those who are in recovery. Students who are in that moderate to high risk categories receive that brief intervention that we've talked about, engaging them in evoking change talk and having them consider how ready they are for change. And students have the ability to download, print, and email those resources, as well as a certificate of completion to prove that they have completed the course. So now we're going to take a look at ScreenU. After we're done looking at the screening that a student sees, Kristen's going to walk you through the campus dashboard that you would have as the ScreenU administrator. So the screen you're seeing now is the first screen that a student would receive or a student would see once they receive the campaign for ScreenU. So this welcome message is customizable to your campus and by the campaign. So for example, if you are screening students who are involved in Greek life on your campus, you can tailor this message to be something that's more specific to them. And if you are screening all first-year students, their message might look a little different. ScreenU is anonymous. We do not collect any data that is specific to, that we would need to identify a student. So we are only looking at their gender, their class rank, and their age. We're walking through the alcohol version right now. So this is the gateway question for ScreenU alcohol. And it's asking, have you had a drink in the last 12 months? And from this, you're going to go in one of 3 different pathways. So if a student indicates that they're in recovery, no matter whether they answer yes or no to that question, they're going to receive resources that are specific to recovery. And your campus has the ability to identify what those resources are. So if you have a collegiate recovery community on your campus, this can be a driver to that. We've seen that here at Ohio State. Students who have taken ScreenU then realize that we have a collegiate recovery community, and maybe they didn't realize that before. And we've had our staff at the collegiate recovery community indicate that they've seen people being referred because of taking ScreenU. Connects them with local support groups. And we also have a resource category called Recovery Allies, where you can indicate a person or people who may be people that would be supportive of students who are in recovery. And this is especially handy if you don't have a formal collegiate recovery community on your campus. You probably have someone on your campus who could serve as an ally to those students and help connect them with support. Students who say that they have not had a drink in the last 12 months will see this screen. So this is our positive reinforcement screen, just saying, great job. And here's more information if it would be beneficial to you. Students who say that they have consumed alcohol in the last 12 months will then take the full screen. And so for our 2 programs, the questions there's 9 or 10 questions depending on the program. It's all on one screen. Again, for ScreenU alcohol that you're seeing right here, these are questions from the audit that we're using, and we use their scoring system. Once a student answers all of their questions, they receive feedback, and that feedback is specific to them based on their responses to those questions. So it identifies their risk level. So this person is at a minimal risk for experiencing problems from their alcohol use. It also identifies based on their age. It gives a note about even if you're at minimal risk, it's still important if you're not of legal age to consider that puts you at risk of legal consequences to be consuming alcohol. So we have that indicator in there as well. For our prescription drug screening, it also gives you some feedback that is specific to that behavior that we are talking about. So if a student indicates that they're misusing prescription medications to help them study, a common misperception there is that using prescription stimulants will help me do better in class when the research indicates otherwise. And so we have some points in there that can help debunk some of those misperceptions that a student has. And that's specific to those behaviors. So once a student reviews their feedback, then we move into the questions that simulate that motivational interviewing. So these are questions that are meant to evoke change within a student. So getting them to reflect on why they're interested in maybe changing their drinking behaviors. If they decided to stop drinking, what kind of positive things would they see from that? And that second question there, if others have expressed concerns for your drinking, what have they said? That question will occur based on how they answer the question around people expressing concern during the screening. The feedback from those open-ended questions is all available for your view in our reporting CSV as well. So that's really interesting because, and Kristen's going to talk more about the reporting features once you take a look at the dashboard, but it's really nice to see some of the common themes, and those themes definitely occur with students on as they're answering those questions. So this is our readiness for change scale. So we ask students how ready are they to make a change, and they have the ability to answer from 0 to 10 on this sliding scale. We also ask students about how confident they are they can make that change. And based on their response to those questions, we'll determine what kind of resources they receive at the end of the program. So here we see resources for a high-risk someone who screened at a high risk level. And these are, again, populated by your campus. And if you were to take a look at the whole page, you'll also see some strategies to reduce their risk. So they have resources to help support them, but they're also getting information about how they can reduce their risk of experiencing negative consequences from alcohol use. Finally, the last page that students see is our thank you page. That text there is, again, editable by you per campaign, so you can follow up with some specific information or directions if that's appropriate for students to follow after taking the screening. That ScreenU resources page that we just saw, students have the ability to download, print, and email that to themselves. When they go to email, there's a note that says that we don't record your email. So those aren't recorded on our end, but it just allows the system to send them so that they have them to refer back later. Students also have the ability to download, print, and email themselves a certificate of completion, which is great if you're using ScreenU in a mandated sense or just want to know who completed it. Each of those certificates have a unique identifying number on them so that you can tell if you get 10 of the same number, something fishy's going on. And with that, I'm going to toss things back over to Kristen, and she's going to show you our administrator dashboard.
Thank you, Cindy. So we'll be able to see ScreenU here in a second. Okay, so this is one of our demo accounts. So this is not real data, and we've just populated it with fake screening so we can show you kind of what you would see when you log into your dashboard. And there will be a few more changes coming down in the next month, so it'll look a little bit different, but the entire idea is the same. In the future, within the next month, you'll be able to have a single administrator for a campus like Ohio State University would have kind of a super admin, and then there will be different departments underneath that one person that can have their own sub accounts with their own campaigns that are not accessible by the other departments on campus. We found this to be something that some campuses were really interested in the event they target certain groups of students, and that information is kind of sensitive if they didn't want the rest of the campus to see that information. So first we have the dashboard, which shows kind of a snapshot of the reports. So here are our latest quick stats of the last 5 days of responses for our ScreenU alcohol, and you can see breakdown by risk level, as well as a breakdown of those in recovery, which is kind of neat. Below that, you'll see the ScreenU national data, so you can kind of compare it to what's going on across the country. Then we'll have ScreenU RX, National ScreenU RX, and then below that, we'll have the marijuana information if you do decide to subscribe to all three. Right here, we have the ability to create campaigns, which is what Cindy mentioned earlier, but this is the tool that we use to deploy the actual URL that the student would access the screening through. So again, it is completely web-based. A student doesn't need to download anything to their computer. They don't need a username or password. You can honestly have the campaign URL just written on a coffee cup, and a student could take the screening and go through SBIRT right then and there. So that's one thing that we're really excited about. So this is where you access your current campaigns, and you can get kind of a snapshot about what's going on your campus. So if we had, for instance, a College of Nursing, College of Pharmacy, Greek Life, Newcastle University. So here are just some examples of the campaigns that we populated, again, with fake screening data. Right here, we can see quickly how many responses we have so far. This is our start date for the campaign. So if I wanted to create a campaign for the first 6 weeks of school, I would change that start date to, August 25th, 2016, and I'd end it 6 weeks later. And that campaign would collect data for just those first 6 weeks. This button is a button that we would use to create a follow-up campaign to target the same group of students that we targeted before. And so you can see change over time aggregate data. Again, we don't collect individual student data, but change over time is something that you can do if that's what you're looking for. This is a button to see the reporting for that particular campaign quickly and easily. And this power button notes that the campaign is currently still open. This red button means that the campaign is closed. So we can see that the end date ended in the past, so students can no longer access that particular campaign. Because this campaign has 0 responses, we're actually able to delete it. So if I accidentally created a campaign and I didn't end up using it and I didn't want it in my dashboard anymore, I can easily delete it. As soon as students actually start taking the screenings, we don't want the trash can button there anymore in case you accidentally deleted it. That would be a big bummer. So we remove that. Same goes here for the RX, and then again, we'll have marijuana as well. So I'll show you quickly what the campaign looks like. So we'll go to the College of Nursing. And then right here is where I can edit the details of this particular campaign. I can change the end date if I wanted it to end past 2018. I'm going to get aggressive and go to 2019, and I'll leave it open for that long. This is the name of the campaign. So a student would see a URL with College of Nursing at the tail end of the URL, which is kind of nice. So a student would trust that URL. They know it's coming from somewhere that they're familiar with. This is the welcome and the thank you message area that is changeable by campus per campaign. So I can make a little note about the College of Nursing supports you. And you can tailor that message per that campaign. So I could update that if I wanted to. If I was ready to go ahead and deploy the campaign to a group of students, what I could do is either copy the link or go to the link, and it would bring up the actual screening. So right here is the link that you would use to share with the students. You could send it in an email, or there's a lot of different ways to do it. Put it in presentations, put it in the syllabus for a class, give it to all the lacrosse players at Ohio State. So that's where you would access the actual campaign URL. If I wanted to create a brand new campaign, this is where I would go ahead and do it. So I can choose which campaign I'm interested in. Let's create a prescription drug one, and we'll do the sorority. And we'll have it start today at this moment, Eastern Time, and we'll have it end in 1 week, same time. I'm going to keep the welcome message and the thank you message the same. Now this is an important feature that I'd like to note. So you can send screening to an identified group of students. So if I was the head of Greek Life and I knew all the email addresses for those girls in the Pi Beta Phi sorority, I could upload them with an Excel file or a CSV file right here. And I could create that campaign. And what would happen is each email address would have a unique URL associated to it. You could do what's kind of like a mail merge, and each student would receive a unique URL, and then the administrator can see which students took the screening and at what time it was taken. The data from the screening, i.e. their risk level, that is stripped from the student's email address, but you can track if a student had completed the actual screening. The neat thing about that is this follow-up campaign button can then be utilized and create another campaign the following year or the following 6 months to that same group of students. And then you can compare the reports for those two groups. So you can, again, see change over time in an aggregate way, which is really neat. So speaking of reports, I'll show you what that looks like. So again, here are all of our campaigns, and then I can click and see the reports. We'll do student athlete report. So here's a quick dashboard, and you see that up here there are 92 responses. And if I just wanted to see how many of that 92 are in recovery, I can see that 10% are in recovery. Now all these graphics are downloadable if you wanted to do a presentation to your administrator about the need for resources to create a collegiate recovery community, and you wanted to include this information, it'll be easily exported into a report for you to use, and you can grab those graphics. It breaks it down by gender, class rank, and age as well. And then each question is actually, you can see the responses. So we can see that 24% of folks answering how often do you have a drink containing alcohol drink 2 to 4 times a month. And then we have 20% of this campaign drinking 4 or more times a week. It is then broken down by demographic here. So you can see by gender, class rank, age. And you can also see, based on these answers, how ready they are to change. So you can see if 20%, this 20% who are high risk drinkers, if all of them are ready to change, that's something good to know, and the support services should be provided to them. And down here you can see again overall risk level, just like our beginning dashboard, but just for this particular campaign. Now, if I wanted to see the results for the student athletes just the first six weeks of school, not the entire year campaign, this is where I would do that. So I could see just a particular group of screenings based on the time that they were taken. So that's just another feature to reporting. If I wanted to compare reports, that's something I can do as well. Like I mentioned before, if I decided to do a follow-up campaign to beta phi, I could do the second one as well and compare those two reports. So if I wanted to compare the College of Nursing alongside, let's see, where did our student athletes go? Here we go. We'll do the beginning of the year until today. Generate this report. And I can see this being useful for folks, let's say in Greek life or in athletics, who want to compare two different teams or two different chapters, see the differences between their risk levels for alcohol, prescription drugs, or marijuana use. And then you can kind of target your resources to the folks who might need it most. And again, this is all exportable, and you can print the data if you're interested in that as well. You can compare the report to the national report as well, and soon you'll be able to compare your campus to campuses in your region or campuses of the same size as you, which will be great. I'll briefly go over the campus resources. So Cindy did a great job explaining the different types of resources and the importance of populating these resources for your students, and just the neat aspect, the fact that a student taking the screening on their fingertips, on their mobile phone, on their computer, has all the resources provided to them by their campus, which is sometimes hard to do. It's hard to provide that to a student. It's hard to understand how well supported you are on campus when you're a student. So we can see that we just have a couple of these are grayed out. That is because I have not added any resource in this field. So I don't have any Recovery Ally resources populated, nor do I have a student organization or campus activity resource populated. Over here, I can see how many of a particular category I have populated. So student health, I have student sports psychology. I also have the student life, student health services. One thing that wasn't shown was a student gets a lot of information for each of these resources. I know when you go through the screening, right now you just see view website, but that's an accordion, and you can drop down and see all of the information on a student's phone. So on their phone, they do have all of that information.
Okay, Kristen. Well, thank you so much for sharing the dashboard with us. One of the things I want to mention is that we have 7-day demo accounts available for campuses for free to try. So if you want to take a look and see what ScreenU is all about on your own time, we encourage you to request a demo or sign up for one on your own by visiting screenu.org. Go to the ScreenU Programs tab and visit Demonstrations page, and that we can set you up with a demonstration for ScreenU so that you can see what it would look like for your campus. If anyone has any questions, we'll be happy to take those now. We have a couple of questions coming in. So Mary Jo Harris asked, is there a list of schools who are piloting this? So we haven't published a list of schools that are piloting this, but we're happy to share. We have schools of all different sizes. Of course, we've been piloting it here at Ohio State since November. The University of Michigan is piloting. We have Clemson University, University of Florida, Emory University, Mississippi State University, University of California, San Diego are some of our larger schools. We have a number of smaller schools, University of Mount Union, Ohio Wesleyan University, Wittenberg University, as well as some community colleges, University of Rio Grande, Illinois Central College, and we do not have any campuses in New Jersey currently piloting. I know that was a question of Mary Jo's as well. Another question, Andrea asked, when will pilot data be available? So our pilots are running for a full year, and we had one pilot cohort start in January and another one start in March. So they are still in the middle of their pilot, and they will complete those after one calendar year. So many of them have been implementing in a variety of ways already, but quite a few of them are looking at doing a really strong rollout for the fall semester. So we anticipate having some really good information probably towards the end of the fall semester around how campuses have the experiences that campuses have had. But so far, we've heard some really positive things. Another question from Diane. Are you considering merging the alcohol, marijuana, and prescription drugs at some point? And we've thought about that, but we know that there's a lot of challenges with doing that. One of them is just the length. So we think one of the things that we've heard really positive feedback from students about how short and brief it is, because so many other web-based intervention programs are significantly longer than this. And so we think that is something that's really important to maintain, is the brevity of it. And so at this point, we'll be maintaining 3 unique screening tools. See if there's any other questions coming in. Well, while we're waiting to see if we have any other questions, I just want to let you know of a couple of things. One, we'll be recording this webinar, and it'll be available on our YouTube channel in about a week. So I know that we went pretty fast during parts of it, and there's a lot to take in with ScreenU. So we encourage you to visit our YouTube channel, which you can find by going to our website, hecaod.osu.edu. And review the webinar. We're also happy to schedule one-on-ones with you to walk through the program with you and your staff or your stakeholders to talk about the details of the program, as well as how it might complement some of your current prevention efforts.
We have a question from Amy. Amy asked, what are the pricing structures for the programs? So again, there are going to be 3 programs, and the pricing is $1,000 for each program for a year, or you could bundle all 3 for a cost of $2,500, again for a full year. And this includes the ability to have multiple departments on your campus with multiple administrators. So it's all included, including the quality assurance, the technical assistance, and the training. That's all included by the Higher Education Center. There are discounts for multi-year, so you get a 10% discount if you do 2 years and a 20% discount if you do 3 years. We really want to keep the price low because we understand that resources and budgeting in higher ed is certainly a challenge and a barrier to do all the great things that I'm sure you want to do on campus. So we're thrilled to be able to offer it at this price.
One last thing, while we're waiting for any final questions, we just want to mention the national meeting that is coming up August 2nd through the 4th at the Blackwell Inn at Ohio State University's campus. So it is a conference that is focused on collegiate prevention, intervention, and recovery. And so if you're working in that space, we encourage you to come. There's more information on our website at, again, hecaod.osu.edu. That's the slide that you're seeing right now. And we're offering a special discount code for all of you who are joining us on the webinar today. So if you're interested in that, please reach out to us, and we're happy to share that with you. In fact, we'll send a follow-up email to all of you with that information, so that, as well as the webinar recording link. We had Alexis wanted us to mention the prices one more time. So if you were to purchase one program, so ScreenU Alcohol or ScreenU Marijuana or ScreenU RX, it would be $1,000 for that one program. or you can purchase all three as a bundle for $2,500. And then again, we offer multi-year discounts. And that pricing is available on the ScreenU website, screenu.org. So I think with that, we'll go ahead and wrap up our webinar today. Thank you so much for joining us. We hope that it was helpful to kind of take a look and walk through the ScreenU tool. Again, we're happy to assist you further, encourage you to set up a demo so that you can play with the tool on your own time. And if you have any questions, please reach out to us at hecaod@osu.edu. Have a great afternoon.